who are attending this session for the first time. The Young Leaders Council is a selected group of dynamic leaders from different walks of life with the aim of bringing in fresh thought and new insights to AIMA's mission. Now, let's talk about healthcare, right? I mean, technically, all we've spoken about in the last 2 years is healthcare. But healthcare in India traditionally has been a corporate and governance subject. In the post COVID era, however, some of these cracks across costs, data, technology, across the stakeholders mapping has been exposed. And it is now very, very imperative for us to consider a complete overhaul in how personal, community, and organizational healthcare is dealt with. Now, while we want to talk about solutions, just for that purpose, we have some brilliant speakers today on our panel. Without much ado, I would like to welcome Dr. Marcus Rainey, who's the founder and CEO of Human Edge. It's a brilliant bestseller book. If you haven't read it, get your copy now. He's also the senior fellow to the Atlantic Council. He's a doctor and has been a frontline medic during COVID-19. Welcome, Dr. Marcus.
Hey, Tanya, good evening. Hello to everyone.
Awesome. And we also have Mr. Amit Mookim, who's the MD of IQVIA South Asia. And he was previously, spent most of his career as partner at the Global Healthcare Services at KPMG. Welcome, Amit. Thanks so much for being here.
My pleasure. Good evening, everyone. Thank you for having me over, Tanya.
All right. Well, pleasure is ours. And I'd like to start with Amit first. Amit, let's try to speak to the audience in introducing them around two things. One is the stakeholder mapping of the healthcare industry currently across end users, the public-private healthcare systems, and the government. And then can you help us with some data, some intelligible data that you obviously can share around how this system currently operates?
Okay, so let me try and paint the overall picture first, right? And then we'll kind of keep going down, and I'm sure there'll be questions. So when I look at healthcare in our country, the picture that comes into my mind is trying to put wheels on a car while it is moving, right? And that's exactly the situation which all of us have witnessed. Break it down into four parts in terms of understanding what is really going on and the topic that is today of digital health. One part which has everything to do with the patient, right? How the patient accesses information, how the patient accesses a medical facility or a doctor, buys medicine, or even understands how he or she wants to go down the pathway of care. So that's one. The second is the entire supply chain of bringing in a consumable or a medicine from the manufacturer to the end consumer, right? That's the second place where a lot of disruption is happening, and I'll speak about it. The third place is like education, like many other sectors, which is a developmental agenda. Health is a developmental agenda of any country. And we've embarked on the largest universal healthcare program in the world, right? We are only 2 years down the line for something that takes decades.
Yeah.
Right. And the fourth thing, which is literally what is going on today, is the entire highway which has got created because of data being one of the cheapest has led to different ways to access and buy healthcare, right? Now these are the three or four things that are causing disruption, and all of these are interconnected. But reality of the situation is, and when we look as IQVIA, we work with life sciences, we work with providers, payers, everybody in the healthcare ecosystem, to bring in research right down to launching something in the marketplace. One of the challenges we see in India is the highway itself is not fully built out. Let me give you now examples, right?
Okay.
One is, of the 500,000 or so doctors, and nobody even knows what the exact number is, less than 5% of them have any kind of a practice management software, right? So, which means, how will anyone look at what kind of patient data is flowing through? And every episode becomes a single episode and not a journey, right? So the treatment of care is actually broken down, which leads to further higher costs of care because you're not able to contain it, right? So that's one. Number two, in the Indian ecosystem, there is 1.5 lakh crores of medicine that gets sold in the whole year. 50% of that is acute. And by acute, I mean basic infectious diseases and what is used largely for both primary care infection and some critical care infection. And half of it is chronic, which is really chronic diseases that needs lifestyle care, right? And the chronic disease market is growing at 2 times the acute market, and the overall industry is growing at 10%. Now, if you peel this downwards, the industry works with a network of 55,000 distributors and a little under a million chemists, right? The average size of a distributor is less than 5 crores of turnover. Now, understand the nature of this industry. And what you saw in the last 2 years, one of the things was the breakdown of the supply chain system because of this. That's number two, right? Number three is today, if you look at the dichotomy between the infrastructure and the spending, right? 70% of the spend is in the private sector and 70% of the infrastructure is in the government sector. And when you look at the payers, it's only over the last 12 months that more and more liberalization has been happening by the insurance companies, right? Now, and which is the reason why I'm bringing this right now, is that this will have a major impact going forward, because what is changing is the distribution and what is changing is the products that will lead to better preventive health. And which is why I think it's a great conversation, Tanya, you set up between Marcus and me, because I think one of the things we should talk about is how we bring the cost burden down by more and more preventive, right? So that's the third aspect. And the fourth aspect, which, and I'll kind of hand it over back to you, is if I compare global versus Indian launches, and let me take you to another example, which is the automotive industry. We used to see a car being launched in the Americas in, say, year X, and 5, 6, 7 years down the line, the car would come to India. A similar situation would be in medicine, right? India
Yeah.
would be, the average launch would be 36 to 48 months after a global launch. Now the average launch is 9 months after a global launch, which means more and more innovation is coming into India. The challenge is the access to innovation and the financing of that innovation is yet to be built out, right? So I personally feel there's, the cracks have opened up massive opportunity, and that's manifested in the amount of funding that's going in, that's manifested in the number of entrepreneurs that are coming into this space.
Fair enough. So I would actually like to continue and ask you a follow-up question, but let me just switch to Marcus to probably start from the basics and then try to just cohere this data. And Marcus, what I want to really start with you is, we spoke about preventive, right? And then there are cracks in system where there's an existing supply chain and there's an innovation issue, and now all of that is sort of sped up. But when we speak about preventive, how much of a component, regardless of whether it's acute or chronic in terms of the condition, how much of that component is personalized and how much realistically needs help as you see it currently in the current ecosystem?
The position that I've been in has been an interesting one because, I used to wear a very medical practitioner's hat when it came to this as a practicing doctor, whereas now, so as an entrepreneur, one sees it from a slightly different lens, right? Now, this idea of who is responsible for my health and well-being, what is my role to play at an individual level in that, is one which has been going on for many, many years. And whether it's the conversations you have in corporates, whether it's the conversations you have with individuals, with the government, with insurance, everyone is trying to understand where they fit within this ecosystem. As I sort of connect the dots, one of the things that I've noticed from my career is the role of behavior in all of this. In any of the decisions, it's the role of behavior, and it fundamentally starts at the atomic level, which is us as human beings in that process, right? If I look at my hat as a doctor and I see a diabetic patient in front of me, when I first started my career, I always found it mind-boggling why, when I saw that patient 6 months later, their compliance to the medicine that I prescribed was typically in the region of about 30 to 40%, right? Most people will start taking their meds and then they just drop off it. They don't take it for long periods of time. You see the same with people who are trying to give up alcohol, with smoking, with any of the behaviors that we have, right? Most individuals who create a resolution for themselves on January the 1st, 92% of them have given up by the 21st of January. So there's a fundamental creation that we need to do around health and well-being in the long term by fixing behaviors. I think the role of behavioral science is therefore very important from that perspective. So as I look at this problem, whether it's the corporate health or individual health or any of the roles in insurance payer provider, it's how do I nudge the individual contextually to make the right decision for themselves today, which pays them a dividend over their lifetime, but they don't see the result today, right? As human beings, we are gratified by dopamine, which is a very intense neurotransmitter, which creates an immediate high, but I don't see that in the long term. So it's that which we need to address and fix. Now, whether we use sort of carrot mentality, whether we use stick mentality, that sort of has to be factored in. But I believe the simplest way, and that's quite often why when I talk about these ideas, it's through that biohack, which is start small, start today. What is the one thing that I need to do today, which if I keep doing it over a long period of time, leads to a transformative effect in a long-term benefit? And it can be really small today, but it compounds up through tiny exponential change over a long run. So that's how I view this problem. It's personalized to the individual. It has to compound, but it begins with a start small, start today mentality.
Wow, very interesting. You know, when you use the term investment, this is almost like how we as individuals don't understand long-term investments, whether it comes to health or finance. But not digressing, what I'd also want to sort of ask is, now you spoke about behavioral science, right? And the two components of behavior, obviously there's the neuroscience to it and there's the bioscience to it. Please correct me if I'm wrong. But are we really dealing with the mind being the primary factor here, or can we do something more physically, wherein the neurotransmitter to make that decision is not really an impulse, that is received by us, senses? And how does one even start? So let's say we were to analyze today the brain works, and then get someone to, whether it's carrot or stick methodology, like you said, get someone to understand why they need to do something. How would you approach it on a personal level as a doctor?
Yeah, so I think I would prefer using the word brain rather than mind, because brain and body are the organic components. Mind is sort of metaphysical, the program that sits on the code. So when we look at with brain versus body, I think both actually are equally important. And I'm not using that as a cop-out clause, but as human beings, we often pride ourselves in thinking we are logic-driven species, that we're logic-driven mammals, but we're not. Every single decision we make is one based on emotion. Most of those are subconscious. Most of them are based on biases that we carry right from our period of time in the womb itself. Our sort of programming is already starting to be built out. And then we just see execution on that in an internal codification which happens. So when I have that individual in front of me, whether it's I'm playing the job of a coach or the job of a doctor or an entrepreneur, it's understanding that what is the intent of this individual, what is the journey that they want to go on, and what do I have in my control to manipulate the emotions that person is going through. We can present as much logic, right? Every single packet of cigarettes now sold around the world has an image of a lung carcinoma, right? We all know that it's bad for you, but yet we see growth in developing markets, yet we see growth in women over men, right? There's fundamentally an emotion which is driven by having to satiate some deep-rooted insecurity, some deep-rooted emotion within us. So we need to drive this as an emotional lever. And there are many ways of doing it. We can use optimism, we can use pessimism, we can use shock, we can use awe, we can use creativity, we can use negativity. That's for who is it that I'm talking to, what is the context of that individual, and what is the point in time right now that I need to make that intervention, because that will change as well. So it's a pretty complex problem. But with deep data, as I'm sure we're going to talk about later on, I think the power that it gives us to create the right context for the right person at the right time is helping us move in a very positive direction.
Very, very interesting. I think a lot of people should probably, who are trying to quit smoking, maybe get a page out of your book on how to really do it, because I've gone through something like that, and I can completely relate to, the motivators and the different methodologies that might work. Now, so we've discussed the macro when we started the numbers. We've discussed how an individual works. I'm going to come back to Amit. And Amit, if you can now help me understand, how does one sort of correlate the bioscientific data with everything that you've just spoken about to sort of really translate it into real world data to make logical decisions from a business point of view? And help the audience please understand, what are some of these? I mean, obviously the whole environment is quite complex, and I completely understand that, so we might not be able to go there. But could you sort of simplify that into, what are the input variables, what are the output variables?
So, Tanya, very simply put, and when let me take a leaf out of astrology, right? When we create a birth
Oh,
chart of a individual, we look at the planetary position, and then we forecast or predict certain life events, right? And then his or her actions and karmas kind of navigate the outcomes a little bit, right? Same thing is in
uh-huh.
healthcare. Now, one is born with a certain profile, right? And then the environment and the lifestyle influence the journey of life with respect to certain outcomes, positive or negative, that take place, right? And then that profile gets shadowed more and more. And it's often, you know, um, people think that everything is destiny. And let me tell you, real world data is suggesting more and more that it's not destiny and it's not profile. It's a lot to do with the environment and the lifestyle. So that's two things. Now,
Absolutely.
so that's the theory part of it. Now, come to the practical aspect of it. Uh, are decisions related to how healthcare products are designed, and are decisions related to how healthcare products are priced and launched in the market aligned to information relating to environment and lifestyle? The answer is not yet, right? So, say for example, Amit Mookim, who has a certain lifestyle, who has a lot of health insurance, right? Goes and undergoes his test every year, renews his health insurance, but the insurance cover only covers hospitalization. They are not looking at certain metrics that may be at 80% efficiency. So, for example, if I'm at 85 or 90% efficiency of vitamin D3 over a long period of time, it will impact my body, right? Now, that is something which is not looked at with respect to how actually I can optimize my health. But what the insurer is doing today, because the products are only related to hospitalization, are they are trying to calculate the risk and the price of hospitalization, right? They are trying to calculate the reward of me being healthy, which is a dichotomy,
Mm,
right? And now, why is that happening? So there are two, three reasons, right? One is, Marcus talked about one very interesting thing, which is propensity, behavior change, right? And the mindset that bad things always happen to other people and not to me. And I will push my diagnostics down till the last moment till I really feel unwell, right? And in
yeah,
India,
yeah.
the overlay of the environmental factors are so high that sometimes we mix them with lifestyle factors, and we do not know when that impact has started to come in, right? So pollution, quality of water, quality of air, quality of food, stress in traffic, ergonomics, everything else, right? I think there is a lot of work that needs to be done where
Mm.
someone needs to link these variables, track it to the outcomes, and understand the cost on the healthcare system. And that hasn't happened yet in the country, right?
Wow, that's a very interesting thing to say, Amit. And as you were talking about it, I'm thinking, hey, so how would insurance be structured really if we base it on reward? Would you reward for preventive health? Would you reward for tests taken on time? Would you reward for efficiency? Would you reward for being healthy? And I completely agree with the point that, if a flower is not blooming, it's mostly the environment that it's in, and not necessarily the problem of the flower and the manure and other things that you give it, right? Interesting point. Marcus, do you have any inputs on how insurance should be structured if it was a reward point based on proactiveness?
I think there are just two things I'll add to what Amit said, right? If you look at human longevity, which is something which I'm very passionate about, only around 10 to 12% of your ability to live to be 100 years is decided by who your parents are, your grandparents. Everything else is the environment. So it's very interesting from a human perspective, because we often think, oh, it's just my genes and that's who I am. It's not. It's the epigenetics and it's the environmental effect. From a medical perspective, there's a fundamental misalignment between how I'm rewarded as a doctor and the outcome which is seen by my patient in front of me, right? And there are a couple of reasons why this is. Number one, medicine is a very siloed profession, right? If there's a chest pain question in my exam, whether I want to be a cardiologist, a respiratory physician, a neurologist, or an oncology surgeon, I will look at that question. Forget the patient. I will look at that question differently, right? I just have a set of blinkers on, and that's how medicine is practiced. There's very little cross communication between the different verticals, and there's very little degree of appreciation for how these things interplay with one another. The second thing is this: it's where it's practiced, right? I am remunerated by how many patients I see, how many tests I prescribe, how many medicines I intervene with. I'm not necessarily, even though Michael Porter's been saying this for many years, value-based care, I'm not being remunerated by the end outcome of the patient. So we need to transform the way medicine is taught, the way medicine is practiced, and then the way medicine is incentivized and remunerated. All of these things need to change in society.
Follow-up question, if you don't mind. Right. So what I'm hearing is that, and please correct me if I'm wrong here. You practiced in the NHS, right, Marcus?
Correct.
So how was that different from how a GP operates in India currently? And I understand that there are a lot of breakages in our system, so that's a given already. Yeah. But how do you think the GPs do it better instead of someone specializing in a neurosurgery or maybe, anesthesiologist or something of that sort?
I think if we compare apple to apple, so let's just take a surgeon in the UK versus a surgeon in India, right? That's a better comparison. Now, a surgeon in the UK is being driven, or her practice is being influenced by a couple of different variables, right? And I'm just looking at the NHS surgeon. I'm not talking about a surgeon who operates in the private sector, which that's a growing component now in the UK market. So my decision as an operator is based upon guidelines which are being prescribed to be by NICE, which is it's part of the government system. It's not the NHS. It's an authority which sits outside of that. And those standard operating procedures, protocols, are being dictated by clinical evidence, cost efficacy, centralized buying decisions by trusts or larger systems. And then there's a set of rules which are then provided to the doctor. Now, the doctor can choose to accept or refute. If the doctor chooses to refute, they need to justify why they are refuting that particular protocol, medication, or procedure. Yeah, but they're still allowed to do so. But generally speaking, there's a cohort mentality. Right? If there's a laparoscopic surgery which needs to be done for an appendix, there's a certain set of tools, there's a certain set of machines, etc., etc. In India, the degree of autonomy is significantly higher. And without wanting to go into the reasons why that might be, some of it is due to the incentives which are provided to that medical practitioner. The financial incentive, etc. There's a whole sort of system behind that which creates that. So actually, when a doctor is being judged on their efficacy and their performance, part of that is also being looked at. How many procedures did you do this month? What is your target for next month? What is the EBITDA that I'm actually generating per doctor? Which doctors are contributing higher EBITDAs? And what can I do to drive growth from that perspective? And I know someone has commented about profit in medicine. I think that's a different stream altogether. But generally, there are as I'm saying, it's a pretty complex system which has been created. And part of that has to do with what Amit was describing, which is looking at it right from the ground up. How are we judging? How are we basing health and well-being? And how do we create long-term incentives for that for people?
Wow, very, very interesting. This begets the question. I probably just want to stick to you, Dr. Marcus, and be like, do you want to talk about the Human Edge or Roots.life? These are two of the initiatives that you're spearheading, and what are some of those problems that you're solving through both of these initiatives?
I think it was well planned. Amit was describing a problem statement which exists in the world, which is precisely what I'm trying to do with Human Edge, which is the fact of using bioinformatics to really understand an individual's propensity for risk over a long period of time, and then use that data which comes in, whether it's the content you consume, the programs that you engage with at a corporate level through the B2B programs that we provide, whether it's the data streams that come in through the wearable devices that we're all increasingly wearing today, our blood-based tools, our genomic information, our environmental, societal information, and really building a composite avatar of a person to try then and create some sort of predictive analytics around that, to create an incentive structure to ensure that the long-term well-being of that individual is well taken care of. That's essentially what we're doing at Human Edge. What we do is our customer acquisition strategies and an enterprise, right? We work with large corporations to provide programs, but essentially it's collecting that data, it's mining the data, and then building almost a crystal scoring system of health in the long run. That's the problem we're trying to solve.
Okay, brilliant. Amit, do you want to take credit for that, and also probably storytell some of the other visionary, solutions that you're driving through the company?
No, I think the point Marcus is mentioning around bioinformatics. If I relate to what's happening in the real world situation, it's called personalized medicine. And especially in areas like oncology or certain rare diseases, right? It has already started to happen. But in a country like India, when we look at just the basic size and access, we will need to probably start at the point of preventive rather than curative, right? Now, when from an IQVIA perspective, we recognize the gaps that are there in the ecosystem with respect to data, with respect to digitization, and we are making a lot of effort to actually help build that in the country. We've set up a center for AI and machine learning for healthcare and pharma in our center in Kochi, where we've created our own certification program because we realized that this throughput will be needed actually to help grow the industry itself. So we are creating the supply of talent ourselves because we saw that that talent was missing. Uh, we've been involved in rolling out initiatives around the Ayushman Bharat since its launch, and we recognize that it requires both the public and the private sector to work together. And a big part of it is the National Digital Health Mission that the government is now creating, where they are going to create an open architecture for companies to plug in while they manage the core, which I think it's a brilliant concept, and it encourages innovation in the country. I think the part which I would love to see more and is bringing the payers onto the table, because the payers have the overall interest and incentive to reduce the cost of care, right? And I think them along with corporate India has to play a big role in this, because corporate India is the only organized part of the country that we have, where if partnering with forward looking organizations building in programs for the employees, and this is no better time when people have understood the costs of pandemic and the benefits of preventive care. And I'm just hoping that when corporate India will look at this and work through with both the insurance and the brokers to create these products on the points Marcus is talking about, bringing in some of that data, tracking lifestyle, linking it to productivity, linking it to better employee health and reduced premiums for them. I think then the wheels will start turning, but it'll take time.
How much time would you forecast? I mean, given that we all deal with data, it's probably a good question to ask you.
Yeah. So, Tanya, what has happened in the last 3 years? The good part is
Hmm.
that we've got a lot more healthcare infrastructure at the front end level, right? So we've got teleconsultations going on. People can buy medication online. The diagnostics people can sign up, right? All of that infrastructure has come closer to the patient. Now, I think over the next 3 to 4 years, I'm expecting that some of the distribution of these products, and I do foresee that insurance will come up with micro products. Like you have a recharge card of 5 to 10
Okay.
rupees. I feel that in a market like India, people will buy micro insurance, right? And that's where
Hmm.
the distribution will explode. And you already have the infrastructure with fintech companies now who can distribute these products.
Yeah.
The linking of this to the platforms that are there, and then for some forward-looking insurers to create these products tested in the market. I would reckon it's already started to happen, and I wouldn't be surprised in the next 1 or 2 years we'll see some of these products coming in into the marketplace. Yeah.
Wow, great. Okay, makes sense. Dr. Marcus, I'm very curious. So, if you had to imagine a wearable with an app, basically trying to measure everything, just give us some examples from existing products in the market that you've experienced globally, right? Which you think sort of make the right combination of monitoring everything right from your heart rate to, how much of let's say when you wrote your book, you wrote about performance, right? And you've worked with a lot of marathon runners. I know you personally are a marathon runner. So if you had to sort of talk about efficiency both from a health perspective and a performance perspective, what is the combination of wearables, just to kind of simplify things that you would imagine right now with existing stuff in the market?
Yeah. So if I look at the current technology, I think there are probably 3 or 4 big devices or very available devices which provide interesting data, which is very usable, right? I would bucket the all the watches together in one. It doesn't really matter whether it's an Apple or a Samsung or a Fitbit, etc. But that information which is providing me around general degree of movement or mobility, general degree of step counts as well. And then interestingly, for the more advanced devices, the heart rate variability, which is basically a surrogate signal for strain on the body, the stress response. That is also something very useful and something that we do a lot in the performance coaching world to really gauge how intense was that activity and how much rest is required in order for that individual to then return back to baseline before you load them up again. So these type of devices are very useful for that. I see Amit wearing the Aura Ring. So that's another very useful device. The whole collection of data which comes in through sleep. Sleep is underappreciated, by the way. I remind people that evolution is such a beautiful science that anything that's not needed is very quickly, in evolutionary terms, planetary timelines, is very quickly gotten rid of. But sleep remains something which practically every mammal, most amphibians and reptiles, etc., still have with it. And it's there for a purpose. And we need to utilize it to our advantage, particularly from a performance perspective. And we see that a lot in the high athletes that we work with. And now we're translating that same science to corporate leaders, to everyday folks, etc. How can you use sleep as your performance enhancing drug? So measuring your sleep, the quality, the consistency, and the quantity of it is very important indicators as well. And then there's some, there's obviously the other types which give me surrogacies to blood-based things. So, I've often experimented with a glucose monitor, the patch that we can wear on our tricep to try and monitor what your blood glucose levels are. There is the Viome chip, which Naveen Jain speaks about around microbiome. So I know Apple's new watch is coming up with a glucose device, etc. So I think what we'll see is this sort of sensing equipment, which will come in over the next couple of years, which will start to pick up on some other more intrinsic biological or physiological signals that we can manipulate. And so it's an exciting time for us, because when you view these with the right signal to noise ratio, and doing it in a way which there's an intent which is being directed towards. I think there's a lot that can be done to guide an individual through the right direction, because I always believe you can't treat if you don't measure. And now we've reached that stage where now we can measure these things. It's easily available if you've got the access and affordability. And therefore, we can use that to scientifically prove and create the right programs for individuals.
Wonderful, wonderful. I think I'd be really happy, myself for one, if you could actually train all of the CEOs, whether large organizations in this country or smaller, to probably recognize the importance of sleep. Because if you think about our generation, right, it is not about performance. The human brain is only supposed to be attentive for 8 seconds at a stretch. And please correct me for the statistics if I'm wrong. And also technically in a day, our most optimum work, specifically sitting in front of the laptop, is not more than 5 hours. And this is my personal example, right? But technically, we have jobs which are increasing in time, which is so difficult to cope up with. So where does a person go? I meet people my age who probably look 40, and it is very surprising to me. And it, it's so difficult to sort of reverse that cycle because they're in the system, they're getting conditioned. And how do you sort of bring them out of that and sort of work on them? So I think maybe Dr. Marcus, it'd be nice to see your journey over the next 10 years with the kind of, data and the depth of things that you have on the healthcare front, really, really working with some of these large concerns to change around how healthcare is looked at in every organization. Amit, does your organization also do work on that paradigm with other organizations at all? Or is it mostly commercial data?
So we do a lot of clinical research, Tanya, right? So
Okay.
we do a lot of research with respect to certain diseases, certain software, digital therapeutics, which is the new avenue for combining it with medicine. I
Okay.
think one of the areas where there is no research happening, and some of the larger tech companies like Apple and Google, etc., are trying to do, is take non-clinical lifestyle data of individuals that Marcus is talking about, right? And correlate that with the onset of diseases and outcomes, right? See, a lot of the research and investment has gone in to cure someone once the disease sets in, right? But if you have to target the other part, you need the individual to also participate, and you need to have those plugins to be able to correlate some of the environment and lifestyle factors. Yeah.
Makes a lot of sense. Dr. Marcus, also, I'd like to touch upon this. You were on the front line as a medic during the COVID-19 pandemic. In fact, you ran a initiative for redistributing medicines in Mumbai, if I remember correctly. Tell us a little more about that in terms of customer centricity. So, what are some of the ground level problems that you notice that people are going through right now, and how would you imagine solving some of these? And then, Amit, I'll come back to you and we'll go to audience questions for the last 15 minutes.
Yeah, so it was actually a very practical solution that it's something I started with my wife. It's called Meds for More, and the idea was, so in the first wave, I was a frontliner. I was working in slums in Mumbai, and seeing firsthand the effect that this disease was having on people's lives. Of course, the health effects, but also the livelihoods, right? The economic damage that this was doing, particularly in those marginalized and lower socioeconomic groups in the country. In the second wave, our workloads for both my wife and I, she's a clinician as well, just went through the roof. It was crazy, and clearly teleconsultation was something that at least allowed us to keep engaged and try and meet with as many patients that we could. But the problem was always this, is that there was this huge group of people who neither had the affordability nor the access to the limited resources which were even available in terms of medicines. So it started right here where I'm sitting, actually, on my dinner table, wherein I got a phone call from one of our domestic staff. His son was diagnosed with COVID, and he called to say that, can I bring the reports? I said, of course, do so. And as he was coming, my wife and I were just chatting, what can we do to help? Because, Faviflu, for example, is a very expensive medicine. And like that, there are many others which are expensive. So I had 3 patients in my building that I was treating, all of whom had just come out of quarantine. So I just put a very simple message on the WhatsApp group to say, folks, with anyone with any medicine left over, send it to me. If it's okay, I'll check it and then make it available to this individual. And it turned out that between those three, we had enough medicine for this one person. And that's when we realized that if one building could come together to help save one life, then imagine what one city could do, one locality, or the country. Now, Tanya, 2 months on, this program has exploded. We're live in 12 cities in India. We've collected just under 1 metric ton of medicine. Almost 1,000 kilograms of medicines have been collected. We work with the biggest NGOs in the country, almost 20,000 villages across the country. We've created this reach for. And it's all through the simple generosity of individuals just giving us their leftover supply. We're not asking them. I haven't collected a single rupee in financial donations, but we've got partners like Uber and Amazon and all other kinds of folks, reverse logistics, picking up medicines from people's homes, checking them, checking the expiry, segregating them, and then giving them to people who need it. And that's where we learned that this simple act of small kindness can go a huge way to creating positive change in the world. And no act is too small, right? Even that one act of us sending that one message led through this nationwide initiative. And now what I'm trying to do is engage with public sector stakeholders, large corporations, to try and create a legacy around this. Because in India, Amit was sharing the statistics. Over 500 crores of medicines are wasted in India. Every year, 47% of your out-of-pocket spend on health is because of the cost of medicine. And something like 50 million individuals are forced below the poverty line because they can't afford that cost in this country. This makes economic sense, it makes health sense, but it's also just the right compassionate thing to do. So we're trying to see how we can create some legacy around this and bring the human act of kindness and compassion into this act of healthcare.
Thank you for sharing that, and thank you for doing that. I think all in all of everything that you've done since I've known you. Amit, I'd like to throw some spotlight on you. Before that, I'd also like to sort of share. I think volunteering, the power of volunteering and the power of community is just so big, especially during these times of duress, that it's been interesting how the country is just, and how networks are working, more so for the younger people, but also, for hyper local communities placed in different parts of the country. Amit, you've been, so in my view, you've been the youngest for a lot of things in your career, right? So help us probably bring the personal angle to who Amit is and what was his career journey. And also you're a marathon runner. So how do you deal with healthcare as a subject on a very individual or a family level?
So Tanya, let me answer the second question first. And
Okay.
the reason why I took to running at the age of 38 was in my family there was every possible chronic disease that I could see on a list,
Oh,
right?
wow.
And then I realized that if the quality of life has to be made good, you have to invest in your own health. So since the last 6 years, I have been building my own data set, right? So I do a full blood profiling across all my hormones and everything else. I track all of my metrics. So there's a data file I've created on my own self. I'm not like Dr. Marcus. I'm much smaller there, but I do understand that one has to take ownership of their own health and not depend on the system. And it requires time. Like we manage our finances, we manage our family relationships, we manage our career, but we do not manage our health, right? So we need to be the chief executives of our own health. I think the other piece you talked about, see, I come from a small town, Tanya. I come from Asansol, which is close to Bihar. That's where I was born and grew up. And I think it's also sometimes what happens is when you come from smaller towns and you move to the city, the fire is much more to make things happen, right? Because you want to prove yourself. And maybe that along with being at the right place and wanting to do as much as I could and not saying no to new opportunities kept me going. So I started with consulting. I was in banking. I moved to HR consulting. I went to the US, did some tech, came back and did private equity advisory, and then moved into healthcare. So all of those were disjointed. But when I look at the pattern of how it's played out really well. I think my learning from all of this is that you should never stop learning or being curious, right? You should continue to reinvent yourself, because if you reinvent yourself, you remain young, and you need to have health on your side, actually. And the two things I practice religiously is 8 hours of sleep, irrespective of whatever happens, and some kind of movement and mindfulness in the morning, right? I think these two
Mhm.
are my pillars, which have kept me going.
That is brilliant. Thanks for sharing that as well. Um, I have one more question, and this is mostly because we are in the IMA session. So most of the young crop would be management graduates. Break down consulting for us, and what sort of skill sets are you looking for when you're looking for consultants, specifically hiring fresh graduates?
So there are three things which make a good consultant, Tanya. I think one is
Mhm.
excellent problem solving skills and the ability to look at a problem from 30,000 feet as well as 5 feet. If one can do both, right, then one brings in a perspective of strategic as well as the operational things of how it needs to be done. Number one. Number two is consulting is a very people oriented profession. The ability to work with people, understand people, their motivations, because when we advise, we will impact the career and the life of some people. So understanding that and having that emotional intelligence is incredibly important. Number two. I think number three is one needs to be very very open to different situations at different points of time, right? It's not linear, it's non-linear. So it's exciting for some people, very unnerving for some people. And I think it's a great, what I personally have advised everyone is everyone should have a consulting gig during their career, either
Yeah.
the beginning or during the mid part of their career. It just opens up their mind to many other things. Yeah.
Very interesting. Maybe I will reach out separately. I don't think I have a full-time consulting gig. Little bit here and there with like the hourly ones. Dr. Marcus, coming back to you, since you started as a doctor. By the way, I prepared for medical science. I was not very good at giving exams. Also, I felt that, oh my God, this is too much studying. So didn't end up becoming a doctor and did the run-of-the-mill engineering MBA. But help us understand for people, looking to get into medical practicing globally. What are the sort of pathways that you see apart from necessarily becoming a doctor, and what's really opened up now as you see globally coming to India?
Yeah, it's become a really exciting sphere, especially because of the events of the last 18 months, right? I think it's put science back on the map, which is precisely where it needs to be. I'm glad Amit said that. In fact, my first job in India after I quit clinical medicine was as a management consultant. I worked with the LEK group for a couple of years, and then I was an independent management consultant for a while as well. And I completely agree. The broadening effect it gave me in those few years was incredible. The ability to understand how dots need to be connected, how human emotions are at the basis of every decision which gets made. Even though you think that it's a P&L and a business plan, it's the human beings behind it which ultimately you're betting and investing on. So it's a great thing for any young mind to think about, to get that sort of practice in before looking to build your own longer term career. I think in terms of medicine, Tanya, to answer your question, it's really broadened now. I think there's some very interesting new avenues of exploration. And even if you look at my batch, I mean, I started med school 20 years ago, odd, and of our group, roughly between 25 to 30%, I would imagine, have left clinical medicine full time and are now doing other
Oh,
things. Yeah, and that's a big investment, by the way. So in the UK, when I started training, the numbers were it roughly cost the government around £250,000 to train up a single doctor. So that's a lot of money which gets invested in a human being, and so it should be used wisely. But I think there are lots of new avenues. There's clearly the entire data centric path which has opened up. There's the whole sort of systems level thinking, which is now being reimagined. whether it's the WHO, whether it's the new sort of pandemic task forces which are being created. You've got the entire payer-provider network, which increasingly needs medical minds. There's the whole aspect around sort of chief well-being officers, which are now increasingly cropping up in large organizations. And then, of course, there's all the new tech. There's the CRISPR-Cas9s. There's the VRs and the ARs. There's all the microbiome. There's the oncogenetics, oncodiagnostics. So there's lots and lots of things that a central education, that medicine, because medicine is just, it's not a science only, it's an art as well, right? There's a lot of human empathy which gets built into that. So I think it's a very exciting sort of profession. And I keep telling my daughter, who has a very steady hand, and I hope she may become a surgeon one day. She's not even 3, by the way, just to give you some context. But I keep telling her that she can be a surgeon of one of the moons of Jupiter. That's my plan and vision for her. Yeah.
Oh, that's so cute. So you have a son and you have a daughter. Amit, do you have kids as well?
I have a 10-year-old son, Tanya.
Oh, that's wonderful.
And a 7-month-old pup.
Oh, so that's the adopted one. Okay, brilliant. Right. So here's the thing. I was looking at the audience questions. I think we've covered a couple of them around insurance, around how to reach Dr. Marcus, around solving some of the price problems on a macro level. I basically still urge the audience, if you have any other questions apart from what we've discussed, just keep typing them. We have about 10 minutes. But coming back to the conversation, you can always reach out to Dr. Marcus and Amit specifically, separately. But coming back, Marcus just mentioned augmented reality. Can one of you take the stage and just discussing a little more about that in terms of how far we are into AR just sort of replicating or coming in, so there are so many components of AI and AR. Now, if I split it into a couple of parts, there's data, there's voice, there's augmented reality, which means that you can typically sort of get the experience of a realistic person, whether it's through video or audio. How does that play into the telehealth scope of things, given that we're all digital and at home right now? Amit, Marcus?
Marcus, you want to, let me go first. Okay. Yeah. So Tanya, there's already stuff happening on a few areas in AR and VR. One area which has been very, very relevant and useful is healthcare education.
Okay.
Right? And it was even beyond this pandemic. But augmented reality and virtual reality started playing a big role in training in doctors, paramedics, nurses on performing surgeries and other procedures in that environment, right? Because then you don't need to have live subjects, right? In a way, you can do it in a much more precise environment. And then when you combine it with 3D printing, which I've seen in a few hospitals in the US, you actually can recreate the body and the tumor, and then you work through some of this, right? So that's one place that is happening. I think the other place where I saw a lot of AR being used, and in India already, is on continuing medical education and medical science related information to HCPs and doctors by medical device companies and life sciences companies. So for example, take an example of a stent, right? Now, how the drug-eluted stent would go inside the body, how it would work through, all of that can be better explained through an AR kind of environment compared to a simple video. So that's where a lot of this has started to be used. Yeah. Marcus, over to you.
Right.
Yeah, you very well laid out the different practicalities. I remember I gave a TEDx talk about 5 years ago on the future of health. And in it, I was sort of reimagining what a doctor practicing in 2030 may wake up to if they suddenly found themselves in this time machine. And I think what's really important for us to sort of appreciate and design for is a world in which any of these technologies that you just described, Tanya, act to augment, not to substitute, right? That's really the key, right? And it's important for doctors to sort of embrace this mindset and not sort of run away, because I think AI AI has become the poster child for technology. Yeah. everywhere. And there are two large camps, right? You've got the sort of the world which Elon Musk inhabits, which is all around Neuralink and integration and sort of the Star Trek version. And then you've got the world which folks like the late Professor Hawkins used to talk about, which is more of the Mad Max equivalency of chaos and craziness. So I think it's for us to design. It's entirely in our control. The future is not dictated right now. And it's for doctors to really appreciate and understand, how can I use this to my advantage? So even with what Amit was saying, right, with regard to medical education, I was very fortunate in the medical school that I studied at, which is University College London. Our entire anatomical education was based on cadavers, and not just sections of humans, the entire. So at the start of the year, a group of 8 of us, thanks to the generosity of people who had passed away and donating their bodies to medical science, we had the benefit of learning anatomy on a real human being. Now, virtual reality will teach me the anatomical distribution of, let's say, the facial nerve and learning the names and where it bifurcates. But when I physically dissect away the skin, the fascia, the muscle layers, there is something intimate about that learning journey, which is deep ingrained. Now, even 20 years later, I still remember the smell, the sight, all of it around me. So I think there's a great role to be played with technology, but we should use it to augment the experience, either for the medical trainee, the medical practitioner, or the patient, right? Let's not substitute, let's augment.
Awesome. Mubarak has a question. Mubarak, do you want to just unmute yourself, and we have 4 minutes to go, and quickly ask your question? Mubarak Ali.
Can we
unmute? Let me see if I can find. Thank you.
Thanks for unmuting me. Thanks a lot. Hello.
Hi, we can hear you.
Good evening, one and all. I'm laudable.
Yes. Hello? Yes, you are.
One and all. I'm Mubarak Ali from Kerala. Thanks for the opportunity and inspiring and insightful session. Extending my sincere thanks to AIMA for this opportunity. My question to the respected panelist: when was the last time you did something for the first time? And thanks for the opportunity. 10 mm, you also joined.
Okay, sure. Okay, well, 3 hours ago I did something.
First thing to the panelist, Amit and Marcus, and then you, madam, please.
Thank you, Mubarak.
So I did something for the first time today, and look, I think it's a bit easier because I got 2 young kids, right? So every day there's some chaos going on, which is something new in the parenting journey, which Amit is a little bit more senior on than me. But I love what he said, which is live a life which is centered around growing, and it's such an amazing question. I think we always have to have the growth mindset and anti-fragility mindset. And very practically, I had a beetroot roti today for the first time ever, right? I'm on a gluten-free diet, grain-free as well. And we're experimenting with a bunch of stuff right now, as I always try and biohack. So that's what I did for lunch. I had a beetroot chapati for the first time ever.
Brilliant. Amit?
I spoke to my plants in the morning, Mubarak. Somebody told me that it's extremely therapeutic and it'll make my plants not dry up. So I did that. I will continue to do that. And in 7 days, I will report back to you if that is true or not.
You got to water it as well, though, Amit, right? Talking will only do so much.
Mubarak, am I allowed to answer or not at all? Okay, I'll go. Well, I actually said no to work for this session today for the first time. Typically, my work finishes at 6, but my new work timings are 10 to 7. And I slyly said no to that just to be here with all of you. So I think that's a first for me. I never said no. I never say no to anything. But thank you, both of you. I think we're so grateful to have had this conversation. It also helps that you've known each other, so it always makes things interesting. Amit has already passed on his email ID details. Please go and fetch The Human Edge, Dr. Marcus's book, and it'll be lovely to sort of reach out to him. Dr. Marcus, where can we reach out to you apart from the medsformore.org? Is there any other place?
Yeah, absolutely. I've just posted my social handle as well, and I'm just going to insert my email address. You can hear my kids walking in now. That's craziness. Yeah. There we are.
Oh, that's wonderful. But thank you both for answering all my questions, for taking out time on a Friday. I know both of you are extremely, extremely busy, but I had so much fun doing this, and it was so insightful for me as well. And so the summary is basically start with yourself, start with mobility, start with sleep, and then the rest, well, it is a little more complex, but it shall figure itself out. But thank you again. Thanks for sharing the personal anecdotes. I thoroughly enjoyed this, and well, grateful again from IMA's side as well.
Thank you for having us, Tanya. Thank you. Thank you, Amit.
Oh, I will.
Bye,
Have a
bro.
lovely week.
You too.
Bye.
Bye. See you. Thanks, Rajni.